Everybody, and welcome to the second session of our online workshop series. My name is Dr. Laura Brown and I am an ESRC postdoctoral fellow in the Department of International Development at the London School of Economics, and I have co-organised this workshop series along with Elaine Flores from the Centre for Global Mental Health, which is a joint collaboration between the London School of Hygiene and Tropical Medicine and King's College London partners. We've organised these workshops with the help of a wonderful team of assistants, Billy Turner, Valeria Flores, Natalia Zuniga-Albildo, and also the invaluable help of LSE's Global Health Initiative Events Manager, Chanel Nunez. This workshop series is supported by the ESRC, LSE's Global Health Initiative, and the British Society for Population Studies. In today's session, we have 6 speakers who will present on environmental links with maternal and reproductive health in different contexts. And then we will split into small groups to discuss the talks and related themes. So first of all, we need to go through some housekeeping for today. So please be aware that we are recording the workshop and may make parts of it available on our website at a later date. We will also be monitoring the chat, and anyone posting inappropriate content will be removed. Related to this, please do not share the link via social media. It is advisable to close any non-essential computer applications on your device, particularly apps such as Skype, as these can interfere. Your microphone is automatically muted during the presentations, but you can unmute yourself when we go into the group discussions so you can contribute. If you experience any connection problems, we suggest try turning your webcam off, as this can help. And just as a reminder, we have English and Spanish interpretation available for this event during the presentations. If you need to use this function, please click on the interpretation logo at the bottom of your screen and select the language you want to hear and mute your original audio. So now over to Elaine to introduce the session format.
Thank you everyone for coming again. So today's session we will be running as follows. We will have 6 short 10-minute presentations. So we will be hearing from Kathryn Grace, who is an associate professor of geography, environment, and society at the University of Minnesota in Twin Cities, who will be presenting maternal and reproductive health and climate change. Then we have Liliana Andriano, a postdoctoral researcher at the Leverhulme Center for Demographic Science in the Department of Sociology at the University of Oxford, who will be presenting the effects of growing season draft on young adult women's life course transitions in a sub-Saharan context. Our third speaker will be Murylo Batista, who is a public health researcher, advocate, and activist, who will be presenting social environmental vulnerability to climate change and unmet family planning need in the Dominican Republic and Haiti. Then we will have Valeria Cordano, who is a specialist in gender issues and women's rights in extractive context from DAR, who will be presenting gender and extractive industries in Latin America. Our 5th presenter is Ileana Rojas, a legal specialist for the Biodiversity and Indigenous Peoples Program of the Peruvian Society of Environmental Law, who will be presenting Bringing Interculturality to Maternal Neonatal Health towards a policy for the generation and strengthening of intercultural competences of indigenous maternal neonatal health personnel who care for indigenous women in Junín, Peru. And lastly, Amanda Veile, an assistant professor of biological anthropology at Purdue University in Indiana, who will be presenting globalization, urbanization, and women's reproductive health in Latin American indigenous communities. So please remember, this is a bilingual event. Some presentations will be given in English and others in Spanish. So please use the interpretation channels to hear your chosen language when needed. So these presentations will be back-to-back and then followed by a small group discussion. All the participants will have sent a second Zoom link, which you will need to use this when we finish the presentations, so you can enter your allocated group discussion. There will be at least one of the 6 presenters in each group, and all the groups will have a facilitator to guide the discussions. The discussions will have either a live interpretation available or a bilingual facilitator who can translate comments if it's necessary. So without further ado, let's get started. So Kathryn, please, over to you.
All right, hang on, let me share my screen. Okay, all good? Thumbs up? Okay. All right, here we go. So thank you so much, everyone, for having me and for organizing this. It was a delight and a challenge to put together a 10-minute talk on pretty much my professional work. So, but I loved working on it. So thank you so much for being here and for listening. Okay, let me get started. So let me just really quickly tell you how this talk is going to be. So first, kind of my overarching thoughts on the field really quickly, and then just to highlight kind of ways that we could apply some of these ideas. I have a really short sort of empirical study. It's very probably unsatisfying because it's not going to have all the detail that you would want, but enough definitely to generate conversation. So that was kind of my aim. Anyway, here we go. So I'm going to be talking about maternal reproductive health and climate change. I put the and child in there because often you can't separate them. The way that we've sort of conceptualized reproductive health often includes pregnancy and early infant health. So that shows up a lot in this work and in what I end up doing too. Oops, here we go. Sorry. Okay, so we already know quite a bit in the scientific literature about weather and climate and sort of environmental impacts on reproductive health. We know that weather factors or environmental factors are related to disrupted sleep, which can be a real problem during pregnancy, failed conceptions or sort of missed conceptions, increased risk of miscarriage and stillbirth, increased risk of preterm birth, all of those things. And we've seen a lot of other different sort of related outcomes associated with different weather or environmental characteristics. So there's nothing new necessarily in thinking about how the environment impacts reproductive health. Thinking about climate change is more of a new sort of conceptualization and way that we're starting to understand the types of risks or vulnerabilities that women are facing. And one of the sort of ideas behind this, especially within the climate change literature and sort of forward-looking kind of research, is that these impacts are disproportionately felt by people with fewer resources and less access to power. So while we do see weather and climate or environmental impacts on pregnancy and reproductive health, we see those showing up very differently depending upon who you are in a community or what kind of community you live in. And so that's kind of where I focus my kind of work. And what I think is sort of fundamental to exploring the unequal impacts of climate change on maternal and reproductive health is to record and document them. So I'm a quantitative researcher. My background is mostly in math and statistics. And so quantitative data means a lot to me. And I know there's a lot of complicated history and really terrible things
complicadas y terribles, ¿no? Que han sucedido con mujeres embarazadas y toda la parte reproductiva.
Data, and we do need to be doing a far better job of making sure that we're collecting the right kind of data that's respectful and attentive to the needs of the communities and populations where we're working. So we definitely need data. We need solid statistical analyses that can compare outcomes across groups. And then we need to use the kind of information that we have from these empirical outcomes to actually update and refine our theory. So sometimes I get a bit of pushback when people are like, well, what's the theory that's actually linking these things? And I do think we're kind of developing that through these empirical studies. So that back and forth, I think, is really important. So one of the areas that I like to focus a lot on and think is kind of a key aspect of how we move forward in sort of the data collection and kind of linking data needs with intervention opportunities is sort of focusing on a community with a sort of a spatial, I'm a geographer, so I like to think a lot about what's different in communities or what's important in communities and to really bring that into our quantitative analyses. So bringing in this sort of community-focused research design and approach. So we need to learn as much as we can about how people live. And if we're focused on reproductive health and pregnancy, then we need to be thinking about the risks that pregnant people are facing or women are are facing. And I'm not a qualitative researcher, but I really rely on a lot of the work that qualitative researchers have done in the field so that I can learn about communities, especially when it's communities where I'm not from, to really, or don't have a lot of sort of experience. It's really important for me to do that. And so through that, I can get an idea of how different people's lives are in different communities and over time, and maybe people who are older or poorer or younger or have more or fewer kids face different types of risks. So bringing all of that in, we can get all of that kind of information from plenty of other sources and make sure that we're reflecting that in our quantitative analyses, just that we're capturing those unique characteristics of an individual within their context and bringing that into our research. Okay, so what does that look like in a quantitative research project? So what does thinking about the individual and the community characteristics mean, or how does that show up in a quantitative project? Okay, so what happened for us is I usually work on maybe projects that have 20 or 30 countries and hundreds of, well, maybe not hundreds of thousands, tens of thousands of women with different pregnancy experiences. So really, it's not possible for me to go to all of these places and bring in all sorts of qualitative evidence from each community. But what we had found in a lot of climate health projects that we were doing is that there were communities that kept standing out. People, in particular, people who were living in pastoralist and agro-pastoralist communities really seem to have different types of engagement with sort of the environment in terms of their biological responses to different environmental stressors. So what we realized when we were trying to understand that is that we, researchers, didn't really know much about activity spaces of people engaged in different livelihoods, of women who are living in communities that are sort of dominated by different livelihood strategies. And that information is out there, but it hasn't really been brought into the quantitative studies or into sort of the public health and social science space where I work. And so that made it really hard to think about what is the local environment or what is the influential sort of rainfall or temperature that would be important for food production related to nutrition during pregnancy, for example. So what we decided to do was kind of dig into the literature, pay attention to what was being talked about among the pastoralist and agro-pastoralist communities, and we identified the importance of water holes through all of that kind of information, water holes for animal maintenance, for livestock maintenance, and we really weren't bringing that in routinely into our studies of sort of climate and health impacts in different communities. So we'd been sort of ignoring that because it wasn't part of our sort of standard body of knowledge. Okay, so we decided to focus on this idea of water holes and trying to understand how variation in water holes related to nutrition and then prenatal or pregnancy health related health outcomes. So our specific research questions were, does living near a water hole reduce food insecurity, thereby reducing low birth weight and stunting? And how does this relationship sort of play out over different communities and across time? So is it consistent? Is there sort of one relationship, or is it somewhat determined by some of these other factors? Okay, and so behind this kind of research, like I said, I'm a quantitative researcher, and I work a lot with climate scientists and physical scientists who spend a lot of time developing all sorts of complicated data. And so what we needed to do was get that data and bring it into our project. So behind all of this project, and I won't go into all this detail here, but if you have questions, feel free to discuss this with me later over email or whatever. But we used data from a water point monitor. And the idea is that every water hole within this strip of area that you can see on the map is monitored daily using sort of hydrologic models. So there's a lot of science behind this, but we have daily information on the quality of pretty small water holes. So we can link that kind of information. We chose just a selection of countries based on our health data. Our health data is here. The little crosses are our communities where we have lots of health data. And then the blue dots are our water holes, blue for water.
Kathryn, you have 1 minute, please.
Okay, thanks. So we could link all of those together to start thinking about how water hole quality impacted health in these different communities. So you see we have a lot of different countries at different development levels and also variation within the country. The results, this is one of so many results slides, so I'm just not going to go into too much detail on it, but just really quickly to describe what we discovered. So in general, when there's more water in a water hole, over the lifetime of a child, including the period when they were in utero, then the child has better health outcomes. So the idea is that animals, livestock are better, household food insecurity is reduced, and so that shows up in child health outcomes. However, what we saw is that is not consistent across communities or across households, that there is significant variation in the impact of water hole based on sort of the conditions of a household, in particular related to water, how households get their water. This was actually not something that we've seen done in the literature, or really attention paid to like surface water resources like livestock watering holes. So highlighting that there was significant sort of difference between households was a new finding in the area where we're working. Okay, so really quickly, the conclusion: climate change disproportionately impacts people with less power and resources, including women, including pregnant women. One way of kind of moving the field forward for quantitative researchers is to consider fine-scale variation in climate exposures and risks, and constructing quantitative research projects that reflect these variations. So really thinking about how the individual lives in that space and taking advantage of all of the climate data that we have, the super highly detailed data, to really start to model or operationalize that in a way that really captures the reality of the experience sort of more accurately than maybe we've been doing in the past or focused on the past. Okay, thank you.
Thank you, Kathryn. We need to keep the pace. So now we have Liliana's presentation. Please, Ileana, over to you.
Okay, thanks. First of all, thanks a lot for the invitation. Hello, everyone. I'm Ileana. I'm from Peru. And now I share my presentation.
Oh.
Yeah.
I am sorry, Ileana. I think that first was Liliana Andriano, and then you're number 5. Thank you.
Okay, I will share my slides.
Sorry for this.
Can you see my slides?
Yes.
Okay. Okay, so I'm going to present this paper on the effects of growing season drought on young adult women's life course transition in Malawi. It's a joint collaboration with Julia Berman from Northwestern University. So a bit of background. As we have already said, climate change will affect population processes of well-being in unprecedented dimensions in coming decades. Relevant for the largest ever cohort of youth currently in low and middle income countries. And young people's life course transitions are usually shaped by social and contextual factors, and weather shocks could also alter the economic. Nonetheless, there's been linked investigation of how local environmental contexts, and particularly weather shocks, impact the transition to adulthood in the global south. So in this paper, we are gonna.
Entonces vamos a
between exposure to growing season drought and young adult women's life course transitions. We have chosen
Estamos escogiendo los estudios en Malawi en un contexto muy interesante en cuanto a la población. Los resultados son muy grandes en cuanto a la población, y también es altamente, también el tema de las sequías, ¿no? En Malawi, que es alrededor de 1% por año, y que contribuyen en la seguridad y en la pobreza. Bueno, Malawi también es una sociedad grande en construcción. ¿Cómo esto impacta directamente en las economías locales, las actividades, particularmente en las áreas rurales, donde las personas, en el caso, por ejemplo, de Malawi,
incentives or psychosocial incentives for changes in life course transitions. First, we hypothesize the weather shocks might affect the timing of life course transitions. In other words, the ages at which young women initiate sexual activity, marriage, and childbearing. Families might gain resources both directly and indirectly from daughters' unions. Thus, we might think drought shocks, weather shocks might accelerate uniformation and first birth. And existing work on this is very limited and focused entirely on bride price, but there is reasons to believe we would see impact even in societies where bride price is less common, such as Malawi. We also hypothesize that weather shocks may
también el tema de los shocks. Vemos el apoyo emocional que necesitan las mujeres. Segunda, también la parte cultural, ¿no? Los shocks culturales.
Por ejemplo, las actividades psicosociales.
Weather shocks might affect the characteristics of life course transitions, such as, for example, the types of partners women choose, and also the types of relationship, whether polygynous or polygynous versus monogamous relationships. So women who enter partnership in part for financial reasons may be more likely to choose a partner who is considerably older.
Son más propensas a escoger parejas mayores y al mismo tiempo
women's partnerships opportunities in local marriage markets may be constrained to lower ability men or less educated men. So the empirical approach, we combine 3 data sets. We have the individual georeferenced individual level data from the Malawi Demographic and Surveys. We have combined 3 DHS, and then we take the climate data on Malawi from the ERA Interim Archive, and we use data in order to produce the indicator for drought. And then we also use calendar crop data for Malawi from the Global Monthly Irrigated and Rainfed Crop Areas database, which is used to identify the growing season of the main crop in the area in which the woman resides. Our final sample is composed of more than 70,000 women who have been living in the same geographic area since age 9. In order to measure growing season drought, we use the standardized precipitation evapotranspiration index. It's been identified as the most complete and robust agricultural drought index in Africa, and we calculate it as the proportion of growing season month in which a severe drought occurs in the month prior to the last and second to last completed growing season. We also include
temporadas pasadas, última y penúltima de temporada de
exposure to extremely wet growing season conditions and area control variables that I'm going to show you in a second. Outcome variables of interest are age at first union and age at first conception that resulted in a live birth. These are the results of the model of the association between drought and age at first union and birth. We find that a 1 unit increase in exposure to growing season drought in adolescents increases the log odds of union formation by 0.68, as you can see from model 1. It means that going from no drought exposure to drought exposure for the whole growing season period increases the probability of getting married. To put the magnitude of this finding into context, we find that a 1 year increase in education is associated with a 0.17 decrease in the log odds of union formation, which is significantly different in magnitude from the effect of exposure to drought. And in model 2, we find that although exposure to growing season drought is positively associated with women's transition to first birth, the result is not significant at conventional levels. Then we investigate how drought impacted the sequencing of women's lives by exploring whether women at their first birth within or outside the union. And the results, so basically the reason why we do this is that the results from the previous section suggested that exposure to growing season drought
La exposición a la sequía de la temporada de crecimiento
do not parse out whether women are conceiving prior to or after a union
Ileana,
formation.
sorry, we have 1 minute.
Yes. Okay. So what we find is that exposure to growing season drought leads to an increase in the probability of giving birth following union formation. I'm going to go a bit faster. Here we explore whether drought impacts a number of partner characteristics, and we only find that exposure to droughts has a significant negative effect on the partner's years of education. Going from no exposure to full drought exposure leads to a 1 year reduction in the partner's years of education in Malawi. And then we explore the possibility that women exposed to drought might be more likely to enter into relationships where goods or cash are exchanged for sexual activity. And we find that exposure to drought is not statistically significant. It's not statistically associated 5% level with exchange in sexual activity for goods or cash. And now I'm going to recap. So we find that exposure to growing season drought leads to acceleration in young adult women's formation in Malawi, union formation in Malawi. It also leads to acceleration in first birth within union, and we have marginally significant evidence of acceleration in first birth outside of unions. We find that drought leads women to partner with less educated men, probably due to outmigration of high ability men. And drought also has a marginally significant positive impact on exchanging sex for goods or cash among our partner women. Thanks. I'm sorry for taking too long.
Excellent, Liliana. Thank you so much. So now we have Murylo's presentation. So now over to you, please, Murylo.
Hi, everyone. Thank you for inviting me into this space to share this presentation with you. So this topic is going to be the social environmental vulnerability to climate change in Haiti and the Dominican Republic. So I actually changed this presentation. I actually changed this presentation from last week because of a question somebody asked which was how can quantitative science help advance women's health and the environment? And we can flip this question and we can also ask, how can a feminist approach help advance the quantitative science of the environment? And so my hope is that by the end
Ciencia cuantitativa del medio ambiente.
these two questions,
Vamos a responder estas preguntas.
Index of social and environmental vulnerability to climate change specific to this Caribbean island. The data was sourced from the demographic and health surveys for Haiti and the Dominican Republic. The population data came from the individual women's file, and the environmental data came from their geographic covariates file, which they've compiled from data sources and centers from around the world. The method for developing this index started with aggregating the indicator measures to the cluster level. For those that are not familiar, a cluster is just a neighborhood. Some of them already came aggregated. Then I looked at the z-score distribution for each indicator measure, and the z-score refers to the distance, how many standard deviations away from the mean. And then I assigned 1 to 2, 4 points based on that value. And so these positive points imply that even a negative z-score still indicates climate risk. Then I weighed the points according to a schema, and then I summed. So let's take a closer look at the indicator measures and at the weighting schema. So for this project, the environmental indicators that I looked at were temperature, so changes in surface temperature, green space, and green space is important because proximity to green space reduces some climate risk. Water stress has been a particularly salient problem for Haiti and the Dominican Republic, especially as it pertains to agriculture. And spatial context. At the end of the day, this is an island, and travel time to urban centers could be a significant consideration for accessing shelters. So one problem with climate change indices is they often stop here. And while environmental indicators are an important source of information for vulnerability, that's vulnerability of the land and not vulnerability of the people. And so the goal here was to extend these indices to include both people and land when we talk about vulnerability. So I weighted the factors equally, 50% for social indicators and 50% for environmental. And the social indicators really prioritize women's experience. So household infrastructure, taking into account drinking water, toilet, floor, wall, all of these often fall under women's caretaking responsibility. Communication technology, the proportion of a cluster where women are accessing timely information is an important consideration for vulnerability and communication strategies. Education, wealth, and it's not just about economic wealth, but also economic autonomy. So owning a land and owning house is an important consideration as we talk about, for example, the outmigration of men during climate shocks. Household, so whether a woman's a household head and a number of children under 5, and violence. So interpersonal violence is a key issue in women's health and the environment, especially when it comes to, because it's been very well documented that especially around agriculture, controlling women's body and the land often come together. So let's take a look at what these, the index looked like without the social indicators. And so here we have each dot represents a cluster, and the darker shade represents a higher index value, and the lighter shade represents a lower index value. And here we can see the pattern. There is some variation, so we do see some heterogeneity, but we do see groupings or similar colors come similarly together. So let's take a look at the index now with. And here we can see that with the social indicators, so let me back up one more time. All right, one more time. One more time. Okay, so here we can see that a lot more variability and noise has been introduced. Yes, that's good. We need that variability, we need that noise, we need that additional information in order for us to make good policy decision making. Because if we just rely on an index that depends on vulnerability of the land, when we are assessing where are we going to go to help women, where are we going to go to help communities, we need to take into account people as well. And so, warning, this is not an analysis, this is a visualization. So the two previous presenters gave you analyses. I'm giving you a visualization. And so there's a lot of limitations that come with it, but The index can be
El index puede ser desarrollado fácilmente en lugares de bajos recursos para lugares de bajos recursos por personal con habilidades introductorias a SIC. Entonces, la otra parte de la presentación,
you can take any reproductive health outcome, any sexual health outcome, and overlay it with this index to figure out, okay, we are an organization servicing this need, and here's our index, where do we go? And you can adopt this index for every single particular geography, and I think that's the point. This is standardized as much as it can be. The rest needs to be individualized in order to make the policy decision making useful. So back to our original questions, how can quantitative science help advance women's health and the environment? My answer from this presentation is by combining natural and unnatural indicators into a singular measure to assess climate change vulnerability across diverse populations. Here we were able to compare two countries that, even though share the same space, have very different political contexts. And so how can a feminist approach help advance quantitative science of the environment? By prioritizing political ecologies, experiences, and socialized roles that account for caretaking responsibilities, violence, and autonomy. Thank you.
Excellent. Thank you so much, Murylo. So now we have Valeria's presentation. Valeria, I will be sharing your slides. So I will start sharing now. See. So just let me know when I get passing by.
Perfecto, sí. Muchas gracias, Elaine. Sí, buenos días con todos y todas. Yo soy de Perú, voy a hacer mi presentación en español. Antes que nada, dar gracias, ¿no?, a la iniciativa Medio Ambiente por Salud de la Mujer por la invitación. Yo vengo representando a la organización Derecho, Ambiente y Recursos Naturales, DAR. Esta es una organización de sociedad civil peruana, ¿no?, que tiene como misión fortalecer la gobernanza ambiental en la región, particularmente en la cuenca amazónica, y también fortalecer la garantía de los derechos, con particular énfasis en la población indígena u original. Entonces, en realidad esta presentación es en el marco de un informe regional que elaboramos, hemos elaborado como institución, tanto DAR, en conjunto con la Fundación para el Debido Proceso de PLF, por sus siglas en inglés, y lo que buscamos hacer en esta presentación es compartir con ustedes los principales resultados, ¿no? Entonces, gracias, Elaine, podríamos pasar.
We can go now
a la siguiente diapositiva.
To the next.
Sí. Bueno, comentarles la naturaleza de este estudio. Este estudio se llama Género e Industrias Extractivas en América Latina. Esta es una investigación cualitativa, ¿no?, que básicamente se basa en
This is a qualitative analysis that is based on
a nivel de la
a lot of
región.
content in
Estamos
literature
hablando de
within the region.
particularmente
We are talking
58
particularly
estudios que
with
se han
51
realizado
studies that
en
have
toda
been
la región
performed
relativo
in
a
all
los
the
impactos
region in
diferenciados que
regards
tiene
of
en
all
las
the
industrias
impact
extractivas
that are
en los derechos
differentiated
de
in
las
the
mujeres,
extracting
¿no?, las
industry
mujeres que están en el territorio.
within women rights.
Y como les mencioné, nosotros buscamos principalmente aquí presentar cuáles han sido los principales patrones
We would like to
de
know
impacto
which are the
diferenciados en la
main
región, ¿no? Esto es un poco del contexto,
influence
¿no?
pattern within the
Comentarles que en la
context.
última
I
década,
would like to
desde los años
comment within the
90,
last decade,
lo
since
que
the
se ve en
90s,
América Latina es un auge de las
we see in
operaciones
Latin
de las
America
industrias
a
extractivas,
growth
¿no?
in the extracting
Algo por
industries.
mencionar es que las principales
Something we'd
industrias
like to
extractivas
mention is
en la
that
región tienen que
the
ver
main
con
ones,
minería, con
industry that
petróleo,
are
¿no?
regarding mining,
Sí,
oil
todo
and
lo que es
energy,
la extracción de hidrocarburos, ¿no? El gas
mostly
natural también, el
hydrocarbons,
carbón, y también todo
extraction,
lo que es producción
carbon,
agrícola, ¿no?
also
Entonces, esos son los
agriculture
principales industrias
production.
extractivas
So
que hay en la
those are the
región,
main
¿no?
extracting
Lo
within
que
the
ocurre en
region
América
industries.
Latina, ¿no?,
What
es
happens
que en
in
nuestros países los
Latin
ingresos
America is that our
tributarios
countries,
están
all the
altamente
taxes
dependientes a la
are
inversión
highly
privada por parte de estos recursos, ¿no?
linked
Por
to the
parte
private
la inversión privada de estas
sector.
industrias. Entonces, lo que ha venido
So
ocurriendo
as
en los
well, the
últimos
investment, the
años
private
es que
investment.
los
So what
gobiernos,
been going
con
on the
miras a
past
mantener
years,
esta inversión
governments,
privada de capitales muchas
in
veces
order
asiáticos o
to have
americanos o
all
de
these
otros países,
investment
¿no?
that is from USA or
Eso
Asia,
genera que los
that
gobiernos
generates
hayan
that governments
disminuido los
have
estándares
lowered
socioambientales en
the
las regiones,
standards of
¿no? Y
social
eso también
environment
se
within
ha
the region,
coincidido con
and that also
hechos de vulneración de los derechos de las comunidades y en
made the
particularmente de las
communities be
mujeres,
more
¿no?
vulnerable
Entonces,
regarding their
aquí lo que
rights,
nosotros
mostly
buscamos
women as well.
visibilizar es cómo
So what we have to
la influencia
visualize
de las
is how
industrias
the
extractivas, si
influence
bien en
from the
los últimos
extractive
años
industry
ha sido
within the
particularmente
last
negativa
years
para las comunidades, con particular
For
énfasis
the communities,
en población, perdón, en poblaciones indígenas ha
and
tenido
indigenous
un impacto
populations.
más profundo en los derechos de las mujeres. Gracias, Elaine. ¿Podríamos pasar, por favor, a
Thank
la
you, Elaine.
Entonces, para este
So,
estudio, básicamente,
for this study,
hay una persona, no sé si es...
Perdón, Valeria, and I'm so sorry. Maybe we are having this issue with the live interpretation. You just continue your presentation.
Ok, perfecto, gracias. Entonces, con miras a realizar esta investigación, se buscó claves de la
we try to
autonomía
find
de las mujeres, ¿no? Tomando el concepto de la CEPAL, ¿no? De lo que esta institución entiende por autonomía, ¿no? Que es básicamente la capacidad de las personas para tomar decisiones libres e informadas sobre sus vidas, ¿no? De manera de poder ser y hacer en función de sus propias aspiraciones. Entonces, este estudio buscó analizar de qué manera las industrias extractivas venían impactando en los derechos de las mujeres, con particular énfasis en tres autonomías: en su autonomía física, en la autonomía económica de las mujeres y también en su autonomía política. Gracias, Elaine. ¿Podrías dar un clic más, por favor? Gracias. Entonces, algo que se ha identificado en este estudio es que existe una relación muy directa entre lo que es la planificación y operación de las industrias extractivas y el incremento de la violencia de género en aquellas comunidades donde las mujeres viven, ¿no? Y que están en el marco de estas operaciones, ¿no? Entonces, algo que se ha visibilizado, ¿no? Es que episodios que cuando empiezan a planearse y a operar estas industrias en la región, ¿no? Existen episodios de violencia que pueden ser diversas. Por un lado, ¿no? Lo que es la violencia intrafamiliar, ¿no? Entre la misma pareja dentro de las familias, porque usualmente para los hombres la operación de estas industrias puede representar mientras que para las mujeres puede representar una amenaza, ¿no? Para la seguridad alimentaria, por ejemplo, sus comunidades, o también para los ecosistemas, ¿no? Que ellas defienden, ¿no? ¿Podrías, por favor, dar un clic más? Ahí estoy mencionando algunos. Sí,
okay.
¿no? Eso por un lado, hay un incremento de la violencia de género intrafamiliar, como mencioné, pero también hay un incremento de la violencia por agentes externos, ¿no? Y estamos aquí hablando de agentes externos, ya sea representantes de las empresas, ya sean incluso representantes del mismo gobierno, ¿no? O policías, ¿no? O militares en la región, como en el caso de Colombia, ¿no? Que, digamos, vienen realizando continuamente en los últimos años actos de violencia y con particular énfasis a las mujeres que son las defensoras de la tierra, territorio y medio ambiente, es decir, mujeres que en los últimos años han venido asumiendo posiciones de liderazgo en sus comunidades para oponerse a estas industrias. Entonces, en los últimos años se han recogido múltiples casos de mujeres que han sido asesinadas, como por ejemplo el caso de la defensora indígena Berta Cáceres, es una mujer de Honduras que fue asesinada en el 2016 por oponerse a proyectos hidroeléctricos en su país, o casos de otras personas, mujeres, por ejemplo, en el caso de Guatemala, de Lote 8, que han sido asaltadas sexualmente
that they
también por
have been
oponerse
sexually
a
assaulted
industrias
for
extractivas en
opposing
Guatemala,
industries,
¿no? Entonces,
extracting
hay,
industries in
hay muchos
Guatemala.
informes
So there are
de
a
la
lot of,
CIDH, de Amnistía Internacional, que dan
for
cuenta de
example, in the
casos de
International Amnesty,
violaciones, que
there
dan
are
cuenta de
reports
casos de
regarding
acoso,
sexual
dan
attacks,
cuenta de casos
as
de
well as
criminalización. Solamente como un dato, ¿no? En mi
criminal.
país, en Perú, entre el 2003 y el 2017, hubieron 102 casos de mujeres criminalizadas, ¿no? Y
There were
el
30,000
10%
cases,
de las
criminalized
muertes que
cases,
se
and
dan en
10% of
conflictos
the deaths
socioambientales en el Perú responden a
with
mujeres, ¿no?
due to
Entonces,
social economical
allí la mujer
problems in Peru
defensora
was on
de las
women.
tierras
So
y los territorios,
women
¿no?
that defend their
Como les
lands and their
menciono, sufren
territories,
estos ataques,
they go
¿no?
through these
Hay un tema
attacks
de violencia psicológica
with psychological violence.
como en el caso de Perú, la empresa Yanacocha,
In the
¿no?
case of
Acosa
Peru, the
a las
company
mujeres para
Yanacocha,
que
it's a
dejen
mining
sus
company,
territorios
they
con miras a que estas empresas
harass
puedan
women to
utilizarlos
leave
como
their
parte de su
lands
producción, ¿no?
so
Entonces,
they
eso es una de
can
las
take over
principales
their lands
afectaciones
and
que se
use it as
repiten y son
production.
un patrón
So
en la
these are
región, ¿no?
stories that
El tema de la violencia de género.
continue, and this
Y
is part of gender
también
violence. And also,
dentro de este tema de autonomía
in
física
this
se han
physical
visto
autonomy
impactos
topic,
en
we've
el
seen
tema de los
impacts
derechos de la salud de la
when it
mujer
comes
y con
to
particular
health rights
énfasis
of women,
los
especially
derechos sexuales y
sexual
reproductivos de la
rights and
mujer,
reproductive rights
¿no?
of
Esto
women. So
principalmente
this
se da
is
por
mainly
episodios
because
de contaminación ambiental que
contamination or
derivan
pollution
de las
episodes
operaciones de la minería ilegal o
because
de,
of
por
illegal mining
ejemplo, derrames de
activities, for
petróleo,
instance,
¿no? Que
oil
son,
spillings.
sí, ya. Entonces, de repente voy a abordar un poco más este punto porque creo que tiene que ver bastante con el tema de la salud, ¿no? Como menciono, en Latinoamérica muy recurrentemente han habido episodios de contaminación ambiental, ¿no? Por derrames de petróleo. En Perú, en mi país, uno de los casos más emblemáticos fue el derrame que se dio hace unos años en la comunidad de Cuninico, en Loreto, ¿no? Donde por la ruptura del oleoducto norperuano se derramaron miles y miles de galones de petróleo, ¿no? Y ya se han hecho estudios recientes, ¿no? Después de, esto fue en el 2014, pero en los últimos, en el 2019, al menos han habido dos investigaciones que dan cuenta cómo estos episodios de contaminación han afectado en voces de las mismas.
That is how they affected the lives of women in these communities. And they say that because of the pollution problems, many women got pregnant because, and many of the women that were pregnant, they had abortions, unintentional abortions. And then they had many problems of birth defects. So this is one of the main impacts that these activities have had in the region. And like I mentioned, I also wanted to mention that many indigenous women in Peru tell how destructive industries are linked to many STDs. Many women in the jungle region, in Madre de Dios and Veile regions, they show that there's a link between the activities of these industries and the increase in prostitution rates in these communities, and therefore a massive amount of STDs because of the women that work in these companies, in these industries. And there's a lot, an increase in HIV rates. So we can talk about this a lot more because these are the health points that are more interesting. Thank you. Thank you, Valerie.
Tu presentación.
Yes. First of all, okay. Thanks a lot for the invitation. Hello, everyone. I am Ileana from Peru, and I will present a part of my master's thesis in public and social policies on the Universitat Pompeu Fabra in Barcelona, which consists of an intervention proposal for social policy. And now I share my screen. Can you see? Yeah. Well. First, what do we think of when we hear the word motherhood? We may be imagining the name that we will choose for our baby, the decoration of the room, the gynecology control, or the preparation for the cesarean section. Perhaps we even imagine with terror the sleepless nights that we will have to live at least during the first year. But do we all experience this in the same way? Let's see what happens in my country, Peru, with indigenous women who go through the public health system.
¿Qué experiencias tienen estas mujeres?
This is the case, excuse me. This is the case of Rojas, a Quechua indigenous woman who was forced to give childbirth to his son Sergio, lying down against her will for vertical childbirth. Between pleas and struggles, the baby, Sergio, was thrown to the ground and his head smashed into the ground. Although he survived the infant. The lawyer was denied not only timely care and information about her health, but also non-culturally relevant care. More than 15 years later, and after mass suffering, the boy Sergio unfortunately died. Here's an extract from a logisticist. I must warn that the images can hurt sensibilities, but they are necessary to understand the real magnitude of the phenomenon. Let's see. Now, let's look at another case. This is a real recording of one of the 250,000 cases of forced sterilization ordered by the dictatorial government of Alberto Fujimori during the 90s. The victims were women with a certain profile, indigenous, illiterate, non-Spanish speaking, and in a situation of monetary poverty. These interventions were without anesthesia and unsanitary conditions, and with a health personnel lacking in cultural sensitivity, and understanding. Again, the images can hurt susceptibilities, although they are crucial to understand the real dimension of the phenomenon. What are we talking about when we talk about indigenous maternal and neonatal health? MNH below. First, of critical interculturality, recognizing an unequal power structure for a construction for subalternity. Second, intercultural health, which is the human right to have culturally relevant care. Third, obstetric violence, which is the violation of the body and includes practices such as those in these videos. Fourth, intercultural skills or competencies, which is what the Peruvian maternal neonatal health personnel lack and which will be the center of the intervention proposal. Here are some examples of intercultural competencies postulated by the Peruvian state in recent years. Those competencies are oriented to identification, recognition, openness, appreciation, and respect for indigenous practices, and the emphasis on the need % of the national population is indigenous. Junín is one of the 25 the indigenous woman that we see in the images below to those indigenous people. And in some images, we can see a childbirth, which is protected by the right to intercultural health. In the circle. The indigenous maternal however, the intercultural health of indigenous women is not protected in practice, basically because a large percentage of the health personnel who care for them lack intercultural competencies. In the graph on the left, we can see that only less than 10% of Peruvian health personnel are trained in these competencies. Although Junín does not appear in this graph, it follows that there are less than 63 trained in these competencies. That is less than 2% of the health personnel in Junín. Different conditions prevent this personnel from providing culturally relevant care.
Condiciones.
Tenemos políticas en la parte indígena. Disculpe. Tienes un minuto. Ileana, ¿tienes un minuto? Ok. Entonces hay muchos aspectos.
Acá tenemos varios aspectos
del staff, del equipo,
personal
que demuestra que no hay competencias interculturales.
No hay una...
Well, we can see the weakness, the traits, the strengths, opportunities of the specific staff managed in Junín, Peru. And then the intervention proposal, specifically, it's looking for exactly first, The personal in Peruvian public image serving indigenous women has intercultural skills or competencies. Second, personnel at the Peruvian public are able to provide cultural relevant care. So first of all, we have a first stage of training, and then a second stage that are integral stage. What is proposed exactly? Generation. There are three stages, three big stages, sorry. Like a training program intercultural, then national program if the pilot goes well, and third, national system program. And yeah, in each one we have specifics, things about staff, about how staff maybe have that kind of competencies. And the idea is that the permanence of different posts. How to really implement it? Well, there are 4 phases and stages. Yeah, is about first the study of phenomenon, second, training preparation, training properly, monitoring, supervision, regulation, and then supervision. And I especially stop at stage 1.2, which is about the pre-representation process. I think that is the most important stage. We train, this is the most important, indigenous voices. I don't know if you understand voices. Voices is the indigenous people or indigenous persons that knows a lot about health, ancestral health in the communities. Professionals and experts in indigenous image or intercultural health. There is a quantity, identity, who will turn. Well, there are more specific numbers that how the proposal will be in the future, and a final idea to final my presentation is the again, we need to manage intercultural competencies in the maternal and mental health personnel who care for indigenous women, but no longer from above, but from subalternity. In other words, an initiative not only for indigenous people, but with and from them. We know that any public policy is not only defined by its technicality and complexity, but about all by its legitimacy. The key to the full applicability of this proposal is to ensure that indigenous maternal and neonatal health is positioned on the public agenda, that it goes from being seen as an obstacle to being seen as a necessary for those who make decisions.
Okay, Ileana, thank you so much. I think that we are running short of time, so I will just go over to our last but not least presenter. Amanda, please, over to you now.
Hi, everyone. I'm Amanda Veile. Bear with me just a moment. I've got a baby on my lap, so I've got to do this with one hand. Get my screen shared. Thank you, dear. Can everyone see my screen?
Yes.
And you can hear me okay?
I think that yes. Thank you so much,
Okay.
Amanda.
Thank you. So it's no question today that globalization has major effects on human health. COVID-19 has spread rapidly from its point of origin in China, causing universities and businesses around the world to scramble and close. International travel, a major component of the global economy, came screeching to a halt, and we're all here delivering our talks by Zoom. This case is impossible to ignore, but viral pandemics are just one way that globalization affects health. My research program examines how maternal and child health are affected by globalization in marginalized indigenous populations in Latin America. Though globalization has been defined in many ways, I use the term to refer to the growing interconnectedness of world economies, cultures, and populations. This process often facilitates the adoption of non-localized diets, the transfer of biomedical practices, and the transmission of novel beliefs and values, which generally flow from wealthier to poorer nations and regions. Some globalizing influences yield beneficial health outcomes, at least at broad aggregate levels. From 1990 to 2015, maternal mortality around the world decreased by 44%. This is largely attributed to improvements in prenatal care and access to obstetric technology. But despite these overall improvements, these broad comparisons, sorry, my baby's moving around, do not reflect the breadth of variation at more local levels. So variation within each of these world regions. In Latin America, for example, as we've just seen, indigenous women's mortality and reproductive health are higher and experience many more complications than the national average in every country surveyed. Because globalization can affect women's health in positive and negative ways, it's important to understand why historically marginalized populations also often experience the brunt of the negative consequences. So to consider the effects of globalization on indigenous women's reproductive health, I examined the interrelated roles of three nonlinear processes: the nutritional, epidemiologic, and sociocultural transitions. In the nutrition transition, traditional foods and food production practices are replaced by highly processed market goods with major declines in daily energy expenditure. This increases metabolic conditions like obesity and diabetes, which in turn increase the risk of reproductive complications. The epidemiological transition describes population mortality shifts from mainly acute infectious diseases to chronic non-infectious diseases. This is attributed to improvements in sanitation and improved biomedical healthcare access. As these become more widespread through globalization, indigenous women are increasingly exposed to biomedical obstetric practices and technologies. We learned a little bit about this in the last talk, and these often come to replace traditional indigenous midwifery, such as that practiced by the Quechua and the Maya. Nutritional and epidemiologic shifts are often accompanied by sociocultural transitions in which acculturation and changes in employment and education lead to changes in beliefs and values surrounding women's reproduction. The effects of globalization on indigenous women's health also depend on the nature of globalization. There's a vast literature on negative effects of urbanization on the health of the world's indigenous peoples, who migrate to urban centers, usually in search of wage-based employment. This creates dramatic changes in diet, sanitary conditions, and disease exposures, and employment and social status, all of which can alter women's reproductive patterns. This is a stock photo from Pamplona Alta in Lima, Peru. This is a site where I just started a project on the health effects of urbanization. But modernization is a different process, and I use this term to refer to populations that remain relatively rural and non-industrialized, like the agro-pastoralists that we saw earlier. They maintain traditional subsistence practices, such as hunting, gathering, fishing, and farming. And what we find is that globalization and modernizing influences trickle into these remote regions, usually as local populations begin to interact more with
más aisladas y se integran.
So the modernizing influences arrive piecemeal, but still can cause shifts in diets, fertility, and health patterns of rural populations. So most of my research to date has been in rural communities undergoing this process. The work I'll describe briefly now comes out of my research lab at Purdue University, the Laboratory for Behavior, Ontogeny, and Reproduction, LABOR, which provides research opportunities for Purdue and host national students in the countries where I work. We work on field and lab projects, all focused on globalization and maternal child health. One of my field projects is the causes and consequences of rising cesarean delivery rates in the Yucatec Maya in Mexico. This has been running since 2014 and builds on demographic work that Karen Kramer at the University of Utah began in the early 1990s. We wrote a chapter in this wonderful edited volume by David Schwartz using historical demographic and epidemiologic methods to describe the reproductive experiences of Maya mothers over a 65-year period as the community became increasingly modernized. Notably, birth has become medicalized in the past 20 years. The elderly midwife on the left is still practicing, but most mothers now give birth in public hospitals where prenatal care and cesarean deliveries are very low cost due to several government assistance programs. So we divided a sample of mothers into 3 cohorts. To save time, I'm not going to describe them. I will just summarize some of the changes we see over time. We see an increase in obesity, metabolic conditions, and birth complications. We also document changing beliefs and perceptions surrounding pregnancy and birth. In general, older women report having easy births and short postpartum rest periods. The older women are considered to have been stronger in their childbearing years than reproductive age women are now because they engaged in heavy agricultural and domestic labor across their pregnancies. Villagers believe that young mothers today are not strong and fit for pregnancy, as were their grandmothers. As a result, many believe that today's reproductive age women require extensive rest while pregnant and during the postpartum period, and many even believe that mothers today require assistance in the form of medical interventions while giving birth. Several more of my publications have specifically focused on rising cesarean delivery rates in Latin American indigenous populations. And I co-guest edited this 2019 special issue of the American Journal of Human Biology on this topic. This work and work by my collaborator, Hugo Azcorra, has shown that the Maya mothers who exhibit simultaneous height stunting and obesity have more reproductive complications and higher cesarean delivery rates. And this fits in nicely with recent theoretical work by Jonathan Wells at the University College London, who's argued that
sorry, we have 1 minute.
Okay. Conditions from one generation to the next drive reproductive complications. So if mothers experience nutritional scarcity in early development, resulting in short stature, then live through a nutritional transition and become overweight as adult, may send different environmental cues to their fetus during development. The fetus may therefore grow to be mismatched in size with the mother. Now, this work collectively shows, albeit in an overview, how globalization and the nutritional, epidemiologic, and sociocultural transitions can affect these 4 dimensions of women's reproductive health, even in a rural and traditional indigenous community. And I'll just touch on my new endeavor, where I launched a new project in Peru with 3 Peruvian colleagues shown here. We've collected interview, anthropometric, and blood spot data from 200 women in Pamplona, Lima, and Pachabamba, Huánuco, to assess the associations between women's migration and reproductive status and their immune function and metabolic health. Data collection just ended and the data are being entered. The blood spots are in Peru. I'm not sure how I'm going to get them to my lab with the travel ban, but hopefully we'll have some results from this work soon. Just want to briefly thank my funders, collaborators, research assistants, and the organizers, speakers, and attendees at this event.
Thank you so much, Amanda. It was a great presentation, and I want to extend our gratitude to all of our presenters.